Well, mental health is a big problem. We've been highlighting the challenges and resources available every week for you, but if someone's experiencing a mental health crisis, where can they actually go to get immediate support? Here with us now to talk more about that is Mike Andrick, Sweetser's Senior Director of Adult Crisis and Residential Services. Mike, thanks for coming in to talk about such an important topic. We want to get right into this. Is there a physical place that you can go if you are experiencing a crisis?
Yes, Connor. So we have 4 adult crisis units located in Lewiston, Brunswick, Rockport, and Saco, Maine. And persons can access the crisis residential units where they have an opportunity to engage in services and always moving towards stabilization.
I think admitting maybe that you need help is probably one of the biggest, toughest steps to first take, right? But why would an adult need such a program, and what would the symptoms be to go in and get help?
Sure. So folks might be experiencing increases in depressive symptoms, anxiety-related symptoms, could have increases in environmental stressors. Folks might be struggling with or experiencing homelessness, whether that's street homelessness or shelter homelessness. Folks may be struggling with addiction. Folks may be struggling with mood swings. There may be persons who are experiencing psychotic features. So what the crisis residential units offer folks is an opportunity to engage in therapeutic services in a therapeutic environment that's trauma-informed. And again, really moving towards stabilization, that connective tissue to community providers.
Sure. What would the benefit be of staying in such a program versus maybe going to the hospital?
Well, I mean, there are going to be times where folks do need to access inpatient hospital level of care, but this is definitely an alternative to a hospitalization. In thinking in terms of a least restrictive approach, right? We're always going to embrace that. And the crisis residential units just offer that opportunity for folks to stabilize there versus possibly like in an emergency room.
Gotcha. Okay. If someone's at home watching us right now talk about this, and they're maybe experiencing a mental health crisis, maybe somebody they know is experiencing one, what should they do to get help?
Sure. So you'll see up on the screen, folks, if it's an imminent safety issue, that's definitely going to be a 911 call. But otherwise, folks can access those services through the 988 number that you're seeing on the screen. And we're certainly going to do everything we can to support folks that may be experiencing a psychiatric crisis.
All right. All good info on this Friday afternoon. Mike, thanks so much for being with us to share this important info.